Hello, somebody says a little hour now says there's no sound. Wow. Thank you so much for letting me know. I've been rattling on. My apologies. I'm going to start again. Wow. Okay, let's start again. I'm glad that I picked that up before I went on a break because I was just about to go on a break. So let's just start all over again. Welcome. If you're still here, thank you so much, R&R. A little R&R. I appreciate you for pointing that out for me. Welcome, everybody. I'm Dr. Sylvia, and this is AskAwayHealth. Thank you for joining me today. This is one of our Sunday live streams, and we're going to be tackling questions or comments that have come into my channel over the course of the last 7 to 10 days or so. So we're going to be looking at somebody who's had pain after a C-section that she had 2 years ago. We're going to be looking at somebody who's having irregular bleeding, heavy bleeding with the contraceptive implant. And then we're also going to be looking at the birth control patch and how or whether it can be used if somebody's obese. So these are some interesting questions that have come in, and I think they're really interesting to look at. I think that if you might take something away from all three, but you'll definitely take something away from one of them. So please stick around. Really appreciate it. Like the video and subscribe message is already flowing on the screen, so please take a moment and like the video. I'll really appreciate it, and it tells the YouTube algorithm that we're doing something useful, and so they share this information with the rest of the world and not just us that are gathered here at this time. And it doesn't cost anything. It's just a moment and a click, and that's it. You're done. So please give this video a like if you find this kind of information useful. Much appreciated. And before we go on any further, and before I forget, I want to share my disclaimer. And I usually say that on here we're providing medical information to have a conversation, medical information to guide and signpost people, not necessarily to give any specific treatment. I would always encourage you to please go back and speak to your own medical provider, and make sure that the information that you and make sure that the treatment you're getting is relevant to your health. Somebody please let me know that. In fact, let me check as well, but please let me know. You might do it quicker, that my sound is on. I don't know how I made that mistake actually. Let's see if I can hear myself talking. I don't know if I can hear myself. Oh no, I think we're still at the point where there was no sound. So let me just forward this. Okay, right. That was loud. Okay, thank you so much for that. I appreciate that. Okay, let's take a quick break. Now that we've gotten all the introductions away. Oh no, I've forgotten something. Hang on, I forgot something. I told you guys it's been a bit of a busy week and day, but I've forgotten something. So of course, AskAwayHealth is a health information platform, a health information channel. Those of you who know the channel know that apart from this YouTube platform, we also have a website where, and I'm going to share the link to that in the description box, but on the website, you can find health information that you can use in the way of blogs, more videos, but also the question and answer service. Let me just share our the homepage for AskAwayHealth. So hopefully you should be able to see that. This is askawayhealth.org, and we've got the options for a symptom checker tool that you can use to put in some of the symptoms that you might be concerned about. We've got an A to Z listing here, so you can find different types of symptoms, pop them into the symptom checker, and we'll give you an idea of what might be going on. Or you might just, you might be somebody who just likes to read about different health conditions. We've got a big library of so many different topics, and we're constantly refreshing them every single week. And we've also got the digital concierge, where you can, if you wanted to have a chat with one of our clinicians, with myself or one of our clinicians, you're welcome to do so. Or there's the health information inquiry service, where you can ask a question and we will respond to you directly to your mailbox, and that is regarding any kind of health information that you're interested in asking about. We get lots of very good reviews, and I'm really very proud of that service. So please feel free to use that. So I think that's everything in terms of introduction. I don't think I've left anything out. Let's take a quick break, and we're going to come back and dive into these 3 questions that I've mentioned already, and I think you'll find that very interesting. Feeling unwell but dreading the wait for a doctor's appointment? We get it. Life doesn't stop for health concerns, and neither should you. Your GP consultation connects you to licensed healthcare professionals from the comfort of your own home. No waiting rooms, no hassle. discuss symptoms, get advice, or manage ongoing care, all through secure video calls and chat. It's healthcare that fits your schedule. From hormonal balance to menstrual health, thyroid concerns, or menopause care, our GPs are here to listen. Get personalized, discreet care that's tailored to your needs. Whether it's a minor illness or just a question that you've got, we're here to help you stay proactive about your health. Your GP consultation, because healthcare should work for you. Visit our website to book your consultation today. Feeling unwell but dreading? Amazing. Thank you so much. And thanks to your GP consultation, my partners, for sponsoring this video. Much appreciated. And guys, if you're based in the United Kingdom and you need to talk to a GP, a women's health specialist, please go and log on to your GP consultation. The link will be in the description box below. Book an appointment, book a consultation with us. We will look after you. We will definitely look after you. Let's get cracking, friends. So the very first question, I'm going to share my screen. And like I said, we're going to be tackling 3 of them. So this is the very first one. It says, it's almost 2 years since my wife. And thank you so much for the gentleman who sent in this question. Always pleases me to get questions from guys on behalf of their partners or their wives or, girlfriends or what have you. So he says, it's almost 2 years since my wife had a C-section, but she still gets pain even now. What is the cause? Guys, if you have any thoughts around this, and I hope people can hear me. I'm just checking that I'm not muted. Everything that I'm looking at here suggests that I'm not muted. But if I'm hallucinating, if that's not right, please let me know. So let me know what's been your experience post C-section. I think most women who we ask who've had a C-section and who want to comment on this will say that yes, it's not unusual to experience pain perhaps within a few weeks or months after the C-section. I expect that the pain should be gradually reducing in intensity, certainly by the first 6 months after. What one might experience, if at all, should be very, very minimal pain. But, let me start by saying that that's one of the reasons why it's always a bit tricky to tackle these questions, because there's not much context. It just says pain post C-section. And I can only assume that he's referring to a pain that's located around the C-section scar. That's all we can do, because we don't really have much more to guide us. And because you can also get pain in the vulva area. So you might also get, I'm not saying directly linked to the C-section, but given the fact that she's been pregnant, she's had a baby, we don't know exactly what type of pain that she's dealing with. It's natural to assume that it's pelvic pain related to the scar, which is what I'm doing. But I don't want to ignore the fact that there may be other things going on along her reproductive tract. So is this vaginal pain? Is this pain during sexual intercourse? Is it vulval pain? Do you get my meaning? I don't know specifically. But I'm not going to let's not allow that to stop us or prevent us from dealing with the question. I think we should sort of, take a stab at it and see what could be happening. But I'd love to know if you're in the comment section right now with this live, or if you're watching the replay. I'd like to know your thoughts about what could potentially be causing the pain here, or whether you've had this experience. And in fact, I think some people maybe they've heard that, well, with the C-section you should expect pain, so then what are you complaining about? So is it something that you feel pain after a C-section is something that women should just deal with? Is that something that you've heard or that people have said to you? Well, I want to say that is absolutely false. You're not supposed to just deal with it. Pain after a C-section, especially within 6 months, 12 months, and in this particular case that we're considering now, 2 years after the C-section, having pain around that scar, I think that's not normal. So it's not true that you should just deal with the pain. After the operation, you would usually still be under the effect of an anesthetic. So by the time that starts to wear away, of course, you're going to feel pain, but your tissues are healing. So you'll be on some painkillers the first week. By the first couple of weeks, you will still feel that something is going on there, but you should not be in severe pain. And in fact, many women probably don't even need to use painkillers by the 2nd or 3rd week after the CS. So there will be care with bending down, care with lifting, care with walking, and all sorts of things, because your body is healing. your tissues are healing, the stitches are healing. So I'd expect that pain to really, over that period of time, 3-4 weeks, to gradually settle down. But there's some women that may have pain for a bit longer. Some women may have pain for a bit less. But this situation that we're dealing with here, no, this is not normal. This needs to be looked into. Okay, so this kind of pain that is going even beyond, 3-4 months, should be looked into. I would be worried about pain, say in the first, let's take pain in the first six weeks, 12 weeks, going into 3 months. I'd be thinking about an infection. In fact, before or within that 6 weeks, infection, maybe bleeding that's happening around the scar. We have something called the hematoma, for example, that can cause swelling around the scar, cause pain. So I'd be thinking about those sort of fairly common causes. And that's why I would definitely want to have a look at the scar. And by the way, that's why like here in the UK, after women are discharged home, you get your midwife visits, or you come to see your doctor in the surgery so that we can have a look at the wound, check that it's healing well, because we know that this is a potential site or source of possible complications. So the bottom line is, with this kind of pain, it needs to be investigated. But what could be going on? What are the possibilities? I think the first thing that comes to mind, given such a long time, assuming the pain is along the scar, the first thing I'll be thinking about is it related to scar tissue? Is it related to scar tissue that's not healed properly or not developed properly? Excessive scar tissue that's sort of forming within the tissue itself instead of on the surface of where the cut was made. Is it scar tissue that has formed what we call adhesions? Adhesions is where parts of the body tissues gum or stick together, glue, gum or stick together where they're not supposed to. And in very serious cases, in cases where it's quite complicated, they may even stick organs together. So you might find that the bladder, for example, is stuck to another part, another organ, or some other muscle or other tissue within the pelvic area. And so that's one thing I'd be concerned about, just given the duration of this problem. I'd be asking myself, is this something to do with scar tissue or adhesions that are developing where they should not be present? The other thing I'd be wondering about is nerve damage. Now, during the surgery, of course, it is expected that there will be some damage to the nerves they're cut, because the first cut is the cut to the skin, this tissues underneath the skin, including fat and muscle layers. Before you get to the womb, then the womb is cut, opened up, and the baby is brought out. And then when you're repairing that, you start from the womb. You repair the womb, you repair the layers of the abdomen, and then you repair the skin. So what I'd be worried about, or what I'd be thinking about, is I would expect when you've had a cut, most of the time what will happen is that those tissues will heal. Even the nerves and the vessels that are cut, they will repair. The body would naturally repair itself. But sometimes there may be some significant damage that is done to certain tissues like nerves, and that might cause persistent pain. So in that case, it would be useful to know what is the type of pain that she's experiencing. Burning pain, shooting, stabbing pain, for example, may, around the scar that is, may suggest that she's experienced some kind of damage to the nerve tissue. Okay, let's think a little bit further afield and sort of dive a bit deeper. So maybe it's not just pain on the surface. Maybe it's not just that scar tissue. Maybe she's actually getting pelvic pain. And maybe she's getting pelvic pain because there's some structure in the womb, or other organ within the pelvis that are causing problem. But let's say we stick to the womb. Could it be fibroids? Could it be endometriosis? Endometriosis, of course, is when womb tissue that normally appears or normally is located within the inner lining of the womb starts to show up outside of the inner lining. So it could even show up in the middle layer of the womb. It could show up on the surface of the womb. It could show up in the fallopian tube. It could show up in different places. But the essential thing is, because it's appearing where it shouldn't, it creates problems, including abnormal bleeding and pain, pelvic pain, that could even relate to pain during sex as well. And so that's why I said at the beginning that the context of this complaint that we have here, or this question that we have here, is really important, because you want to establish where is she getting the pain. I'm assuming that is the scar, but I feel that you could also allow for other locations, and that could be, deeper than just on the surface or around the scalp. So we've talked about that. I suppose the other thing that you could think about is something to do, I was talking about the possibility of pain around the vulva. What if there's a problem with her pelvic floor? I know you say, oh, she didn't deliver vaginally, she delivered by C-section, but there could still be challenges when she was carrying the baby. Changes to the pelvic floor don't just happen when there is a cut. Just the fact that one goes through the 9 months or goes through pregnancy, the carrying the weight of the baby, that can also put pressure on the pelvic floor. And we do encourage women to do pelvic floor exercises to tone the pelvic floor even while pregnant, so that it heals, bounces back quickly after the baby is born. So I'm just throwing that out there as another possibility in terms of what could be responsible for somebody having pain after 2 years after a cesarean section. But I would love to hear from you. This is a question that was submitted to us to consider. I've sort of thrown a few opinions together to say, well, it could be a few things. We've talked about the possibility of scar tissue and adhesions. We've talked about the possibility of nerve damage. We've talked about possibility of organs like fibroids or organ changes within the womb, for example, fibroids or conditions like endometriosis. And I've just mentioned something to do with abnormality of the pelvic floor. So I would consider those as possible things. At the end of the day, you're going to have to go and sit down with your doctor to have a conversation about this. The doctor needs to see you. The doctor needs to examine you and identify what is responsible for the pain. It may be that they need to look at doing tests like scans, an ultrasound scan to start, an MRI, depending on what exactly they find on examination to be able to tackle this problem. Let me know what you guys think about the answers or the question and your experience. We're going to take another quick break and then we'll go on to the next question. Please don't forget to give this video a like, much appreciated, and of course consider subscribing to the channel. I'll be back in just 2 ticks. Feeling unwell but dreading the wait for a doctor's appointment? We get it. Life doesn't stop for health concerns, and neither should you. Your GP consultation connects you to licensed healthcare professionals from the comfort of your own home. No waiting rooms, no hassle. Discuss symptoms, get advice, or manage ongoing care, all through secure video calls and chat. It's healthcare that fits your schedule. From hormonal balance to menstrual health, thyroid concerns, or menopause care, our GPs are here to listen. Get personalized, discreet care that's tailored to your needs. Whether it's a minor illness or just a question that you've got, we're here to help you stay proactive about your health. Your GP consultation, because healthcare should work for you. Visit our website to book your consultation today. Feeling unwell? Thank you. Welcome back, friends. Welcome back. How are you doing? Thank you so much for joining me for another live session. So we're going to our next question, and this one is a lengthy read. I'm going to leave it on the screen for some time so that everybody sort of gets to grips. Let me just take off this banner temporarily, but if you're just joining, please give the like button a click. I would really appreciate if you do that for me. So this is a question that's been sent in by one of our viewers. Thank you so much for putting this question in. I appreciate you. And they say they've been on the implant since they were 15. And came off it after 6 years because they were just struggling with bleeding problem. The implant is the birth control rod that's popped in the inner arm, in the inside of your upper arm. That's the picture of the implant. So you can see the doctor holding it up. It's a small rod that looks like just like that, and it's usually placed in the, as you can see in the photo, on the corner in the inner arm. So that's what the implant is. Let's go back to the question. So that's they were on this method for 6 years. A highly effective method. It's one that, once it's popped in, stays in place for 3 years and provides birth control, so you don't have to think about it. Really effective, long-acting form of birth control. But she came off it after 6 years because the bleeding was horrendous, 3 months straight, and it was messing with everything, including her marriage, including her job. Really horrendous bleeding, where she's bleeding through a tampon and pad in 1 hour. That's not normal, guys. That's not normal. Okay. Then as she came off the Nexplanon, and so Nexplanon, oh, I got the spelling of this wrong. My apologies. I don't think I noticed that. This is supposed to be Nexplanon, one of the brands of the implant. So it's just one of the many types of, one of the many brands of the implant sold all over the world. But while she was off the implant, she switched to something else. And that was the patch, the birth control patch. And she says it was still heavy and irregular, but it was only 9 days that she would bleed. However, the problem with the patch was she didn't find it effective because it kept coming off. You know, it's supposed the patch, of course, is the birth control method that you stick on like a band-aid or dressing or plaster. I've got a picture here as well. So that's the patch. And so she's saying that that was a problem as well, because even though the bleeding wasn't so bad, it was just coming off in the shower, coming off at the gym. And then she managed to get pregnant twice while on the patch. So, yep, it wasn't doing the job. And then so she felt she had to go back to the implant, Nexplanon, a couple of years later, and the bleeding just got worse and worse. So she breaks down her bleeding experience. Sometimes she would go for 3 months without a period, which she was happy with. But once she bled, it's very heavy, makes her ill, and it could last for 3 whole months and just kept getting longer and heavier. This is really this is really distressing. And then she further goes on to say very large clots. And then, of course, the challenge that she's having is she couldn't afford health insurance, or she can't afford health insurance at the moment. She's not able to work because the periods are too long and painful and heavy, and it's pretty expensive, spending $200 a month just in terms of tampons and pads. So there's a few challenges, and I put this question forward because I think it brings up practical challenges that we have to acknowledge that we experience, and that some women experience with just trying to lead a reasonable, normal life where you can manage to do things like work or look after family or look after whatever issues. And if you like, plan your family. So she's been on the first method, that's the implant, and I've shown you a picture of what the implant looks like. Contains the hormone progesterone, like I said, a very effective method. And like some women will experience abnormal, heavy, irregular bleeding on the implant. So it's not unusual to experience that, but it's common, usually only within the first few months when you first use this method. If you're using a method and it's more than 3 months, going to 4 months, or even into the 6th month, you're experiencing really abnormal symptoms that most likely are related to that method, then you really need to go and sit down with your doctor. We usually say within the first 12 weeks or 3 months, that gives your body time to adjust to this method. So any kind of irregular bleeding at that time, that's not horrendous. If it's sort of a bit irritating, a bit irregular, you can sort of say, right, let's just keep an eye on it for the next few weeks and see if it settles down. And for some women, it does settle down and then things proceed smoothly. But here we are way beyond 3 months, and she's having what crazy kind of bleeding. She actually, from what I read out, she looks like she stuck with the method for several years before eventually having to just give up because it was just messing things up. And then she swapped to the patch. Again, the patch is an effective birth control method. The patch is pretty much what you have in the combined pill. It's pretty much the combination of the hormone, progesterone, and estrogen, and it's the same principle as what you have with the pills, really, except that you're putting on a patch every week, and you're doing that standard way of taking it, putting it on for 3 weeks, and then the last week you take it off. But there's so many different ways of using it to accommodate an individual's each individual differences. So for some women, they may have the patch for more than 3 weeks and then have a break after a longer period of being, an extended period of being on the patch. And it's simply to manage each woman's individual differences, because for some people, they'll be okay with the 3 weeks on and 1 week off. Some people are better off with the 5 weeks on and 1 week off. That kind of the different ways to manage, different regimes to manage the use of the patch, just as you can have different ways to manage the pill or even the vaginal ring. But going back to the patch, She thought it was fine for her because she didn't bleed so much. The problem was keeping the patch on. So let me just address that. And I do have a video around that, which I think if you're interested, please go on my channel and search for the patch. If I remember, I will try to link it in this video once we're done. About how to use the patch and really being very careful about putting it on. So if you're going to be using the patch, you need to be aware of how to maintain and manage your skin, where to apply the patch. So for example, making sure that it's absolutely dry. Skin is absolutely dry, so you haven't put on cream or soap, or it's not, your skin is not wet. You haven't got anything that could affect the stickiness or the adhesiveness of the patch. That's really important. Because if it is, I know there are women who use the patch very happily, very successfully. It stays in place as long as they want. But I know that there are others who, for some reason, struggle. The patch corner starts lifting off, and it's less likely to be effective at that point. So you really have to be somebody who's quite clear where you're going to put the patch, making sure that when you put it on, skin is absolutely dry. Make sure you put it on firmly, and so on and so forth. All this just to help you succeed in using that method, because if it's not firmly stuck onto the skin, you can assume it's not effective. And she told us that she got pregnant twice on the patch, so clearly it wasn't doing the trick, not because it's not a good method, but because for whatever reason, I don't think she was able to get as much of the birth control as she could have. It was probably because it was slipping off all the time. But what happened next? This is where I'm surprised, because what happens next is she says the patch didn't work for her. She got pregnant a couple of times. The timeline for this story is a little bit off. I don't know, but let's just go with it. She's had 2 kids, and then the patch, she's given up on the patch, which fair enough. But then she decides to go back to the implant. And this is where I struggle, because I think, I don't, why would you do that? Why this method? Now, there may be very valid reasons, and I'm not condemning you at all, because you may have very valid reasons. But I think if a method you used for 6 years and you came off it because you had horrendous bleeding that affected marriage and work, and why would you go back on that method? So I'd sort of put that at the very back and explore other possible methods that perhaps would suit you better. And then the rest of the story she tells us is how she's been struggling with the implant at this stage. She does mention that for some time she doesn't have any bleeding, and she loves that. But then there are times when her period then comes, and it comes back with a bang, and it's months, weeks of bleeding, to the point that she can't even work, to the point that she can't do anything. I mean, that's not living. That's I don't know what that is. That's really, really struggling. So, my first point is, like, I don't like this business of going back to next plan, and I don't think it suits you. I really think you should be sitting down with your healthcare provider to say, what are my options? The patch didn't work, the implant didn't work, and look at other methods of birth control that might be suitable. So some that we might think about are the depot shot sort of comes into my head, because for somebody who doesn't want to experience any bleeding, once you get on the depot shot, that can cause absence of periods for several months. So that there are a few options that could be considered. But do you know what? Before having that conversation about changing the implant, before going on to talk about swapping to the implant, I don't know whether you guys think her bleeding pattern, does it make you feel there's something more going on? Because I certainly wondered, is there anything else going on? Now, of course, the medical issues to consider with the degree of bleeding that she's described, I'd be concerned if she's anemic, and I think that would be useful to do a blood test and find out. And if she is, make sure that she's on the right treatment and supplements for that. But I'd also want to know, is there any other condition, medical problem that's causing her to bleed in this way? Does she have PCOS? Does she have fibroids? Because those are conditions where you may have irregular bleeding, and adding the implant into the mix may just confuse the entire hormone balance within your body and cause really bleeding that's unscheduled, and bleeding that you can't really make any head or tail around. So I think she needs to have that evaluation, and let us be clear what we're dealing with. If she has a blood test, if she has perhaps a examination, blood test scans, no fibroids, nothing else that we can blame the abnormal bleeding pattern on, then we can sort of sit down and have a look at what's happening with the birth control method, like I said, the depot shot is an option. The fact that she's not been very successful with the implant doesn't 100% rule out the progesterone birth control coil. I would also consider it for her, especially if perhaps she's used the depot shot and it didn't agree with her, or she doesn't like the method. I would also be having a conversation with her about using the birth control coil. That is, it is put inside the womb and it contains some amount of hormone, progesterone, as another form of effective birth control. I'm not saying that irregular bleeding doesn't happen in that case. Some women do, but this is a situation where it's worthwhile trying if she's willing, if this is a method that will be satisfactory to her. Of course, the other thing to consider is the birth control pill. Now, like I said earlier, this is exactly what you have in the birth control patch. It's just that the patch is a different way of delivering exactly the same thing. It's the same hormones, but with the pill, of course, you're taking the pill every day. So that depends. Its effectiveness and success depends largely on you taking it. So you need to make sure you're taking it at the same time every day and so on. But I'm just thinking that given the fact that she did experience less bleeding on the pill, on the patch, sorry, why not consider the pill if it's suitable? Depends on her age. It depends on several other factors. Does she smoke? What's her weight? Many different things to make sure that the pill is suitable for her. But you know what? I think there's enough to sort of have a sit down with her doctor and have a conversation around what is most appropriate. Now, let's touch on one more thing which she mentioned, which is this whole burden, this bleeding problem, apart from the fact that I'm sure it's draining her, making her feel unwell, probably anemic given the amount of bleeding she's talked about, but she says she's running through tampons and pads like water, like tap water. So in today's world, what are the possible options, given that it's a whole lot of money that's being spent apart from the health insurance costs and so on? So I wonder whether this is somebody that might consider menstrual cups and perhaps period underwear. And I say that with a caution because it depends on how heavy the bleeding is, and I will appreciate that if bleeding is very heavy, that period underwear may not be the most effective, but it's something to consider. I don't know whether she's considered it. It might be that it helps to support, and it may mean that she spends less on tampons or pads if she sort of gets a decent set of period underwear and she can combine the two. She may need to buy less of the tampons and pads, and the same for the menstrual cup. So it may be that these are options to consider that could help your budget. But let me know what you guys think. Let me know your thoughts. Something similar? Have you experienced something similar to this? Irregular bleeding on any form of birth control? How did it go? How did the problem get solved? You know, what considerations did your doctor have? Let's know in the comment section. To be great to hear from you. But to the lady who sent in this question, it was a long read, but I think it's quite instructive. I think it's a problem that many women will be going through. So really, thank you for sharing this with us. Guys, let's take another quick break, and then we're on to the next question. Please give this video a like. I would really appreciate it. And let's take a quick break. From feeling unwell but dreading the wait for a doctor's appointment? We get it. Life doesn't stop for health concerns, and neither should you. Your GP consultation connects you to licensed healthcare professionals from the comfort of your own home. No waiting rooms, no hassle. Discuss symptoms, get advice, or manage ongoing care, all through secure video calls and chat. It's healthcare that fits your schedule. From hormonal balance to menstrual health, thyroid concerns, or menopause care, our GPs are here to listen. Get personalized, discreet care that's tailored to your needs. Whether it's a minor illness or just a question that you've got, we're here to help you stay proactive about your health. Your GP consultation, because healthcare should work for you. Visit our website to book your consultation today. Feeling unwell but welcome back, and thank you so much for hanging out with me. If you're just joining, you're very much welcome. We're tackling viewers' questions, and we've covered a couple of really interesting ones, so you need to go and watch the replay if you want to learn about possible causes of pain that's persisting 2 years after a C-section, or very heavy bleeding with the implant and how to tackle it. You know, if those are things that you're thinking about or wondering about, we have got some good answers, good conversations around them. So guys, let's go on to the very next question. And this is again to do with the birth control patch. So thank you to who sent in this question. I appreciate you for sending it in. And the question is very, very simple, very straightforward, nice, short and sweet. Does the patch work if I'm obese? And I think it's an excellent question. So this is the birth control patch. And one of the reasons I think it's an effective method. Again, it is the same hormones as what you will find in the birth control, in the combined birth control pill, because don't forget that you have the progesterone only or mini pill. So in the birth control patch, you have the same hormones as what you have in the combined pill, and that is a combination of estrogen and progesterone. And of course, one of the things that is not very popular with regards to the patch, especially where I'm practicing, and I don't know if you guys have an alternative experience, is the fact that this patch is in just one color, so it is not inclusive at all, and it limits the number of people that can use it, which is a bit of a shame. But when you get it in just one color, then it's not discreet. You can't put it on and not expect people to stare at you and wonder, oh, what's this that you've got on? So I think a whole lot needs to be done in terms of looking at why can't we have a patch that is variety of patch shades and tones and hues, the way we have, the way we have different tones for foundation and contour and all sorts of things. Why can't we have similar tones for the patch? So we need our scientists and our researchers to get cracking on that question. But let us address the issue that's in front of us here, which is, can you use the patch if you're obese? So the question really is about using the combined hormonal method if you're obese. The very simple answer to this is there is a caution applied to using these methods if you are over a BMI of 35 or above a weight of 90 kilograms. For two reasons, one of them being the safety and the other reason being the effectiveness. So in terms of the safety, we're concerned about the increased risk of the patch in people who are overweight and possibly contributing to birth complications using the pill. For example, things like blood clots, for example. But the other concern is about the effectiveness, and there are questions about the patch, or there are studies that suggest that the patch or even the pill could be less effective if you're over a BMI of 35 or over a weight of 90 kilograms. So I would really be considering an alternative method. That's what I'll be suggesting. I'll be looking at, because we've got so many different options, I'll be looking at things like the depot shot, for example, looking at something like the implant, for example, to have it for you to consider, where you have much larger hormones, which the chances of them being broken down into your system and not being able to provide enough contraception is less compared to things like the pill or the patch methods. So the answer to that is I would, sort of sit down, and I think, women are entitled to have their choice, of course. But if it's something that you're either running the risk of is not really going to work, or even running the risk of perhaps an increased risk of clots, for example, then it might be worthwhile. I think I will definitely be suggesting that you look at an alternative option, because I think that the chance of it failing and you becoming pregnant when you didn't plan to is much higher. So probably something like the implant, the coil. The coil is another option. The depot shot, these are options that you might want to consider. And they are less, less likely to fail. For somebody who really who insists that you want to stay on the patch, well, you could consider using condoms as well. So, it may be that a combination of the two. So you're trying to cover yourself, cover the bases, because you're just taking that risk. So it may be that you sort of use a condom as a backup method. If you insist that the patch, there's some people who insist that they prefer the patch, or some people for whom other methods may not appeal, or they may have tried those other methods and they don't work. So I'm just going to share my screen because here in the UK where I practice, we use guidance from the Faculty of Sexual and Reproductive Healthcare. I'm a member of the faculty. And we use the faculty's guidance when it comes to all manner of birth control methods, sexual health, because it's the foremost leader in terms of education for sexual and reproductive health in the United Kingdom. But so I came across this page, which I think is really useful, and it's a very simple, quick breakdown on how the patch works. Okay, so it tells you about containing 2 hormones, is used, you change it once a week. But if you scroll down to this page, it says how effective is the patch. Depends on how it's used. If it's used properly without taking other medicines that could make it less effective, it is more than 99% effective. Sorry, let me just make this a bit bigger. It's more than 99% effective, meaning that if 100 people use the patch for a year, less than 1 will have an unplanned pregnancy. So it's a good effective method. But on average, you can expect it to be 91%. That is, given life happens, sometimes you may not stick it on properly, or it may not, given the way that we will use it on average on a day-to-day basis, and we can assume that it's about 91% effective, meaning that out of 100 people, 9 using the patch for 12 months, 9 people will have an unplanned pregnancy. But then it says that it may be less effective in people who weigh more than 90 kilograms. So I think that's important information just to have at the back of your mind if you want to consider using this method, that while it can be quite effective and really as effective as the pill or even the vaginal ring, when you're overweight, you do need to have these further considerations. Right, what do you guys think? What has been your experience? Especially if I have any overweight ladies in the house or obese ladies in the house watching this, what challenges have you had when it comes to choosing a birth control that works? What have you been told? How difficult has it been? I would love to hear from you. But this brings us to the end of the stream. I think it's gone by so quickly. My apologies for the loss of sound at the beginning. I don't know what I was, because I realized that it was showing me that I was on mute, but I didn't pay attention to the sign. So my apologies. I think I'll probably just chop it off when I'm reviewing this video later on. For those of you that stuck around with me, thank you so much. Thank you. And for those of you who've liked the video, thank you so much. Consider subscribing to the channel. Guys, I hope you have a really great week. Please send in your questions to the channel. Don't forget that what we do here is provide general information, not specific advice, to guide a discussion, to help you present the points to your doctor that will help you get more of the answers that you're looking for. So I welcome your questions and comments to the channel. Very useful. But yeah, we've come to the end of this session. So I just wish you a lovely week, and I will see you again in the next one. Take care and bye-bye. Feeling unwell or dreading the wait for a doctor's appointment? We get it. Life doesn't stop for health concerns, and neither should you. Your GP consultation connects you to licensed healthcare professionals from the comfort of your own home. No waiting rooms, no hassle. Discuss symptoms, get advice, or manage ongoing care, all through secure video calls and chat. It's healthcare that fits your schedule. From hormonal balance to menstrual health, thyroid concerns, or menopause care, our GPs are here to listen. Get personalized, discreet care that's tailored to your needs. Whether it's a minor illness or just a question that you've got, we're here to help you stay proactive about your health. Your GP consultation, because healthcare should work for you. Visit our website to book your consultation today.